This is Average Joe PT, and on this episode, we're going to talk about just that chronic knee pain. I've been getting a lot of DMs out there about, hey, what about my chronic knee pain? So let's go ahead and get started right now. So when we look at this knee and why you're having that chronic knee pain, there's multiple reasons why you might be having it, and there's some basic generalized treatment exercises and techniques that we can do that basically covers most of chronic knee pain treatments and how it can resolve them. So number one, when we look at this knee and we have any kind of arthritis on the backside of that kneecap, or maybe just the joint itself, or maybe the meniscus is kind of starting to age and it just isn't taking that squatting, kneeling, pounding kind of tolerance that it used to, one nice generalized exercise that you can do is just basic walking. Walking really is going to help that synovial fluid within that joint space and along that kneecap to really get that knee feeling better. Because the reality is there's not a lot of blood flow in that knee to begin with that can help heal this knee when things get inflamed. Treatment number two, essentially just doing some basic ibuprofen. Now, I'm going to give you a thing that doesn't really work that well, is a knee brace. They kind of slide, they kind of chafe, they can give a little bit support, but the reality is if this knee is starting to hurt or it's chronically irritated days and days and days, a general basic neoprene, kind of that stretchy type of brace over the top of that knee really isn't going to do much of anything. You're better off taking some ibuprofen or icing it than it would be just to wear that knee brace. Though it might seem like it's giving you some comfort, the reality is there's really not much difference with it or without that knee brace. Now, a jacked up knee brace with, metal rods on the side and, this got this big ratcheted thing all over the place. Now, that's a different type of story, and that's a different kind of knee brace. But just the ones over the counter, they really don't do much. Now, those TENS units that you can see that are sometimes used on the back, there's no reason why you can't use them on this knee. So you can go ahead and put one above and one below that knee and just leave it there and do your day. As long as you're not truly driving or any type of motorized equipment, you're just kind of sitting or walking around, a TENS unit can actually help that chronic knee pain a lot more than a brace or ice or, just massaging that knee. So that's, a good treatment technique that you can try. If you have any questions about that, you can go ahead and give me a shout out, and I can go ahead and kind of give you an idea of some different types of TENS units that you might want to purchase either on Amazon for less than $25 that can really help you for that you might use for back. You can actually use it for your knee too. Now, when it comes to this chronic knee pain that you're having, nothing seems to be working too well. The one thing I've shown in the past is some taping techniques. Now, some basic tape you can actually get at any store, white, brown tape, and you can literally put it across underneath that kneecap and lift it up on it. And a lot of times that can actually help support and give some pressure relief to this knee. I have a video out there, I'll leave a tag up for you. I showed you all different types of positions that you can put your knee in and different treatment techniques comfort-wise that you can do to relieve that knee pain while you're doing that activity. So I'll leave a tag up for that. I did it a while back, but it goes over all types of different functional activities that you're doing throughout the day and different types of modifications that you can do to help relieve your knee pain. And the last but not least, when it comes to just this generalized chronic knee pain that doesn't want to go away, and it really could be a tendonitis. Like I said, it could be your meniscus are just kind of worn and just ain't taking the beat like they used to. Could be something as simple as offloading that knee for a period of time. What do I mean by offloading? I really do mean taking this knee and putting it about a 30-degree angle, which means this is the degree angle where the largest space between this bone and this bone occurs is about 30 degrees. That nice angle right about there. Take 2 or 3 pillows and put underneath there and literally just wrap this thing in either ice if it's swollen, or if it's just feeling like it's just sore, you can get away with heat. But if you have any swelling or inflammation going on there, you're definitely going to want to ice it for 15 to 20 minutes. And then go about your business again. Now this you probably want to do more the evening when you're done for the day than you would have been doing during your active day. If you have any questions, go ahead and leave them out. Scully and I, we try and bring this content a couple times a week. But until next time, look up and keep smiling. See you next time, folks.